Wide-ranging survey on how racism and discrimination affect American life finds that minorities in this country expect to face discrimination when they seek health care. They not only expect it, they prepare for it. KFF, a nonprofit group focused on healthcare policy, says that many Hispanic, Black, Asian, and American Indian and Alaska Native adults in the U.S. believe they must modify both their mindset and the way they look to stave off potential mistreatment during healthcare visits. 60% of Black people surveyed, 52% of American Indian and Native Alaskans, 51% of Hispanics, 42% of Asians said that they prepare to hear insults or they feel that they have to take care, extra care with their appearance in order to be treated fairly, at least some of the time. Joining me now to talk about this is Samantha Artiga, KFF's Director of Racial Equity and Health Policy. Samantha, thank you for being with me. This implicit bias does not come as a surprise to some people, but to those who are new to this, explain what you've learned about the different ways that whites and minorities in this country say that they experience health care differently.
So overall, I think the survey findings really highlight how persistent and prevalent racism and discrimination remain in the U.S. today, and how those experiences extend into healthcare, affecting people's experiences seeking healthcare, as well as ultimately their health and well-being. As you mentioned, our survey findings highlight how experiences with racism begin to affect people's experiences even before they get to the doctor's office, with them taking steps to prepare for these visits, concerned about facing insults from a provider or office staff, and also being extra careful about their appearance in order to be treated fairly. But even when folks get into the healthcare doctor's office, we see them being treated unfairly more frequently due to their race and ethnicity, and also saying that they have more certain negative experiences in the doctor's office because of their race and ethnicity. So things like a healthcare provider not taking their concerns seriously, not answering a question or responding to a request, blaming them for a health issue, or not prescribing pain medication that they thought they needed.
You know what's interesting I found in this survey is that the minority respondents didn't think that it would be any better if the healthcare provider shared their race or ethnicity. So this is not a white provider, Black patient. It is the medical services industry. It is the medical profession and the patient as it relates to minorities. Explain that a bit more.
Well, it's interesting. Even though survey respondents said that they didn't think they would get better care if they had a healthcare provider who looked like them, what we actually see in the survey findings is that when adults of color have more visits with a healthcare provider who shares their racial and ethnic background, they report having more frequent, positive, respectful interactions with their healthcare provider. So the survey findings actually do point to some potential opportunities and benefits from increasing efforts to improve the diversity of the healthcare workforce. But we also see that the survey findings are pointing widely to the importance of continued training and education programs to root out the bias and discrimination that are reflected in the survey.
Yeah, and I think we take that finding and mirror that against what we see in some states, specifically in Florida with Governor Ron DeSantis, who defunded DEI, the Diversity and Equity and Inclusion programs at schools, at learning institutions, defunding the implicit bias training at these places, so that any plan, any effort to lessen at least what we're seeing through this survey in some states is really facing some major challenges.
Overall, I think the survey findings really point to the importance of continued action to address racism and discrimination, particularly in healthcare. They show that racism and discrimination are not just a social issue, they are a health issue. And beyond the findings reflected in terms of impacts on people's experiences seeking healthcare, they also highlight the strong link between discrimination and health and well-being. So people who report more experiences with discrimination in their daily life, which remains frequent, are more likely to report certain negative health impacts like increased feelings of anxiety, depression, and loneliness. So there are health impacts also tied to these experiences with discrimination.
Yeah, about more than experience and discomfort. It's about outcomes for these communities as well. Samantha Artiga with KFF, thank you so much.